Hi everyone, I'm Mark Ames. Welcome to 5 on the Frontline, produced by AIHA. This week, we're exploring one of the most important, contentious topics in the nation: protecting the health and safety of students and staff in America's schools as the country passes grim milestones, with more than 4 million cases of COVID-19 and more than 148,000 deaths. Our guest today is David Beatty. David is a senior health and safety industrial hygienist and public health professional with over 20 years of experience in the field and is a recent contributor to AIHA's COVID-19 guidance document for reopening schools covering kindergarten through grade 12. He's the head of industrial hygiene and risk management for MC Dean, a billion-dollar infrastructure systems integration firm with engineering, construction, manufacturing, and sustainment teams operating on 6 continents. Dave also served as the head of public health for Montgomery County Public Schools in Maryland and Florida Atlantic University in Boca Raton. Dave, welcome to the program.
Thanks, Mark.
Dave, as an expert in health and safety, help us cut through the fear and the confusion. What advice do you have for government and school leaders, teachers, and other school staff and families? Is there really a safe way to be at school in person during the pandemic? How can we reduce the risk of an outbreak of COVID-19?
Great question, Mark. Great question. I will tell you that each school system in the nation really needs to have a thoughtful, well-focused plan. And in that, probably the 3 big takeaway points would be physical distancing, your sanitizing, disinfecting program, and then you're educating of your staff, students, and parents with correct information, or PSAs. So when we look at physical distancing, you're actually looking within the learning environment or within the classroom itself, so the class size. Reducing the number within the class size, within the classroom, so this way that you're dealing with a much more manageable group of youngsters there, and that you can have that physical distancing in place. The second part of that would be take a look at your facilities and have a thoughtful plan on that of reallocating your spaces to increase your educational space in your learning environment. The next point would be your sanitizing and disinfecting program. This really comes into play with your facilities plan or your school plan operations of maintaining common touch points for disinfecting and sanitizing those spaces, whether that be in your cafeteria, your handles to your doors, the entrances, the bathrooms, the areas and rooms where you would have or could have an event. They get disinfected with an EPA approved product and then sanitized. The third point that I would suggest would be educating your staff, your students, and the parents. A really strong educational program for the parents of what to do before your youngster leaves for school. That would be your protocol. Some of this is going to change from school system to school system or state to state. But what are the steps that the parents need to be taking in the morning for monitoring the health of their youngster? And then in the event that they do have something to where they're not feeling well, what do I do? How do I handle that? Easy to do steps. The second part of this is to start building an integrated educational program between the teachers, the staff, and the students. Have the youngsters start at a grassroots program of how we prevent, or what are the preventative behaviors that we need to put in place. Examples of this would be for the younger grades, poster competitions. This keeps them physically distanced, it gets them actively involved, it's in a learning environment. Sticker programs would be another perfect example of what to use for the youngsters. How to take your temperature in the morning. For the higher grade levels, we could integrate this into their biology programs, their health programs, and their English programs to conduct research papers on the topic itself. What are the emerging issues that's coming out of COVID? What and how can we do to protect everyone within the school system? So I would close with those 3 key points, which would be physical distancing, sanitizing and disinfecting, and educating the staff and students.
I really appreciate that, Dave. So what would you say to those people who might say they don't feel comfortable sending their kid to school? Help them understand the risks. Is there are the risks being accurately characterized, or again, is there a way where if they implement the protocols that you mentioned and the others that are described in AIHA's Back to Work Safely guidance documents, is there a way to keep folks safe, or what would you say to folks who still have those fears?
So the AIHA guidance documents go right to evidence that has been produced through either the CDC or science-based information. And it is the most up-to-date information that we know at this particular time. And for us to be within those areas, to provide those social interactions, which are so vitally important for those youngsters at this time, and also to take care of that educational or the education slide that happens through the summer that can very easily continue into the fall. That this allows the parents and the staff to continue forward while they're still maintaining that information of scientific data. When you take a look at the AIHA documents, they are going to be updated on a routine basis as more scientific data is coming out.
That is fantastic news. That is without question some of the most important news for anyone to be aware of. So I think that we can all encourage everyone to go to backtoworksafely.org, where that document is referenced. That guidance document on reopening K through 12 schools is housed. So that is all the time that we have today. Thank you so much for coming on the show, Dave. I really do appreciate it.
Thanks, Mark.
And thanks to everyone for joining us. This has been 5 on the Front Line. I'm Mark Ames. We'll see you next week.